If the mother's too ill, or if she's unable to produce milk, then we will use milk from our milk bank in order to initiate feeding. We have a policy here that no baby weighing less than 1,500 grams receives anything other than human milk for the first 6 weeks of life. And this is something that we're very proud of and that we've worked incredibly hard to integrate into the way in which we look after babies here. And we audit this every year to make sure that we are complying with our guideline.
Which is on CPAP most of the time. The donor breast milk is better tolerated, has anti-infective properties. It substantially reduces the chance of necrotizing enterocolitis, which is a severe bowel inflammatory disorder in premature babies. But also human breast milk fed to babies has been shown to be associated with better intellectual outcome and also by school age lower blood pressure. So there are substantial short and long-term benefits from using human breast milk, whether it's fresh human breast milk or donated breast milk.
For me, the most compelling evidence is the evidence in relation to the role of donor breast milk in preventing necrotizing enterocolitis.
Necrotizing enterocolitis is a very serious condition with a mortality somewhere around 20 or 40% and a major long-term morbidity associated with loss of the baby's gut and prolonged parenteral feeding, that's feeding into a vein.
If you can prevent one serious case of necrotizing enterocolitis, which may have very long-term ramifications in terms of healthcare, nutritional support, numerous other things as well. If you can prevent one case, the financial ramifications are colossal. It's more than 5. The other thing you've got to put into the equation is what it costs to an individual to have a baby who develops a complication as dramatic as necrotizing enterocolitis. And there is no doubt for families, for the people who care for the baby at all levels, it is extremely distressing, it's very traumatic.
Due to whatever reason, the trauma of the birth and the prematurity of the birth, I was not able to make more than a few meals for him. And so the medical practitioners took the decision to feed him formula. Later that night, Liam got worse. He diagnosed Liam with having necrotizing enterocolitis, and they rushed him across the border to the nearest level 3 neonatal surgical unit and did emergency surgery. Within 15 minutes, the surgeon told us that there was not enough bowel alive to be compatible with life. They sewed him up and I held him for 3 hours and he died in my arms.
It would appear that the risks of necrotizing enterocolitis are about 5-fold greater in a baby fed on preterm formula. And we can be relatively confident about this risk because it comes from a meta-analysis of 3 randomized controlled trials performed in different parts of the world.
If you can think that you actually did everything you could in your power to prevent that from happening, including the use of donor breast milk, that actually can make a significant difference.